So Andrea, and we've got her assistant. So would you like your name in it, Jane?
Jen.
I want to just kind of show you, we've got non-anesthetic dentals. You've probably heard about it. There's a lot of controversy about it. I'd like to just kind of share what happens if there's significant periodontal disease, if there's any issues with oral cavity. They refer it to a veterinarian who does dentistry, so they work with us. We'll try and show you that it's relatively gentle. Essentially what they're doing is maintenance work to a large degree. They're keeping an oral cavity clean and healthy, pretty much like a scale and polish or brushing. This little pet comes every 3 months, so we'll take a look at how the oral cavity is. He hasn't had any veterinary dentistry yet. What's his name?
Pepe.
Pepe.
Oh, sorry, Teddy. This is Teddy.
So we're looking at Teddy's mouth. This is before the clean. So if you notice, there's almost no plaque and tartar buildup thanks to the beautiful work these guys are doing. They're getting it in regularly and they're keeping the oral cavity really good. So this is the condition that Teddy's coming in for before we start the procedure, not afterwards. And you can see that he's handled very well. Let's look at the other side. Okay, beautiful. So you can also see, I'd like you guys to note that the pet's pretty calm. They've been doing it for many, many years, decades in fact. And the pets are really comfortable with the procedure. They have it every 3 months of their life. And what a lot of us have seen, at least working with these guys, is that a lot of these pets never need a veterinary dentist. They never need an anesthetic dental, they never need x-rays because the oral cavity stays in good condition. Many of the concerns that all of you watching have got is, well, the dog's not anesthetized, they can't pick up periodontal disease, they can't do much more than just the basics. And they're genuine concerns, but for a lot of patients, especially the poodle type and poodle crosses that are genetically prone to dental disease, this is just excellent, keeping them out of the vets and keeping them out of major dental issues. A lot of us are anesthetizing, especially as veterinarians, are anesthetizing pets literally every year to do a dental. And I'm not saying it's good or bad, and I'm not saying it's not slightly traumatic, but I'm just showing you what an alternative can be like and what we can actually do. And then how they do it. Two gentle ladies in this particular facility. And I agree, it might look just a tiny bit stressful, but in life we all go through minor stresses, and to prevent the big veterinary bills, I'm actually a dentist who's actually doing the recording now. This is great. We strongly support it. We can get a little pet that gets cleaned up on a regular basis and doesn't come to us. That's magic. We have sent a lot of our own clients to have this done, especially after we've done a detailed scale and polish with x-rays and ensuring a healthy oral cavity, and why not? So it's a pretty big thing. This is taking over all over the world. I'm really not promoting it for dogs with incredibly bad oral cavities, dogs that have been neglected, dogs that have got advanced periodontal disease. It's specifically for the maintenance type thing like they're doing.
We take before and after pictures of every client.
So you know exactly where you are and you keep a record.
You get me some gauze.
Andrea, you've been doing this for many years.
Yeah, since 1996.
So 24 years. I'll just make a comment that in one of the clinics I worked in, we had a grooming parlor, and we would do what we call tech dentals, or just really quick tartar plaque removals in any dog that had very, very mild plaque and tartar disease. And interesting, most of these pets that were groomed by us regularly never needed veterinary dentistry, there's nothing wrong with veterinary dentistry. They send us a ton of cases, which is the right thing to do, but there's really a good place for this, done the right way. And So gently, as you can see here, swabbing the oral cavity is not stressful at all. And they've got and now they're going to go ahead and remove small, tiny amounts of actual buildup. Got a couple of pets being treated at the same time. It's very, very calm and serene, the atmosphere. I guess if I was doing it, I'd probably like some classical music maybe in the background. But it's really peaceful here. There's no screaming and shouting, and this is typical. They're doing this in this particular facility 3 days a week, and they have multiple patients coming through. We're so busy that there's now we've got two dental, let's call them dental nurses doing the work. And the way we're going, we're trying to build it to 3. So you never know what will happen. But please just note that the pets are really comfortable. And as anyone knows, I mean, gently scraping tartar and cleaning a tooth is not a painful procedure. They're not going under the gums. They're not doing major periodontal work, because these dogs are generally here. They call it maintenance therapy. And it's very big overseas. In America, it's massive. The bad rap that they're getting in Australia is often justified, you know, but not for this kind of stuff where you're cleaning and manually removing plaque and tartar just to keep them healthy. By the way, these dogs all go to vets regularly, and none of the vets they go to have ever suggested a dental, which is another confirmation of the really good work they're doing. And watching them work every day in the clinic and seeing how they do it is another manifestation of how good it is and how happy we are with it.
You're welcome. Happy boy.
Oh, they look happy. Thanks, guys. See you later.